Have you ever noticed a cheesy buildup around the head of your penis? If so, this might be what we call smegma. In this video, I'll explain what smegma is and how to prevent it. Smegma is a white or yellow cheesy-like substance that can accumulate around the head of the penis in uncircumcised males. It forms naturally from the accumulation of oils, dead skin cells and other fluids in the area. Smegma can build up when these oils and dead skin cells aren't washed away regularly. Smegma is only generally seen after the age of puberty, a time when oil production of the skin in the area increases. This oil production declines as we age, making smegma less common among older males. So what's the purpose of smegma? Smegma has a role in helping lubricate and nourish the skin at the head of the penis and the foreskin. Oils also help provide lubrication, which decreases friction, reduces pain, soreness and discomfort during sex. Is it normal to be smelly? You may have noticed that smegma can smell, sometimes really bad, with some describing it as an off-milk-like smell. This foul odour occurs when your penis hasn't been cleaned for a while, and the smegma can accumulate. This accumulation of smegma is the perfect breeding ground for bacteria. Are there any other symptoms to look out for? In some individuals, smegma can lead to swelling and irritation around your penis, making you feel uncomfortable. Some may even report restriction in the movement of the foreskin as a result of the smegma buildup, which may cause discomfort also during erections. How to treat and prevent smegma? The best way to treat and prevent smegma buildup is to ensure that you wash your penis daily. The best way to do this is to retract your foreskin and clean the head of the penis thoroughly using warm water. Warm water alone should be enough. If you're keen to use soap, please ensure you use a mild, non-fragrance soap to avoid any irritation. After washing, patting the area dry with a towel is best. Importantly, ensure you replace your foreskin before putting your underwear back on. If you're ever in a situation where you're unable to return your foreskin back to its original position, you need to speak to a doctor. This can be an emergency. Males in the first few years of life may be unable to retract their foreskin. This is because of a natural adhesion between the foreskin and the head of the penis. As they grow over a number of years, separation will occur, meaning it's possible to retract the foreskin to clean underneath. So for young children, please do not force their foreskin to clean it. It can lead to pain, irritation and bleeding. So when should I consult my doctor? You're unlikely to require further assessment from your doctor if you're suffering from smegma buildup. Symptoms usually improve after a few days of regular washing and maintaining good personal hygiene. However, suppose your symptoms don't go away after a few days, or you develop new symptoms such as pain or persisting discomfort. In that case, you may be suffering from another condition such as balanitis. If this is the case, make an appointment with your doctor for further assessment. We hope you've found the information helpful and gained a better understanding of smegma. If you have any concerns or questions about smegma or other medical issues, make an appointment with your doctor to discuss this further.